I'm good. How are you?
Good. My name's Soleil. I'm going to be your nurse for the day. Okay. What's your name?
My name is Alex.
Oh, nice to meet you, Alex. Okay, so I'm here today to give you a new medication. You've been prescribed simvastatin. So it's also called Zocor. Those are just two same names for the medication. Okay, so the way this medication works is it's going to inhibit an enzyme which is responsible for the synthesis of cholesterol. So cholesterol is the waxy film produced by your liver in response to eating a lot of animal products like meat, any type of meat from an animal, dairy, and eggs. Yeah. So throughout the past couple of months, your cholesterol levels have been increasingly on the higher side. So combined with your history of hypertension, the drug simvastatin is going to help manage your pre-existing high levels of the cholesterol. It's going to slow the disease progression of coronary artery disease, and it will also reduce the likelihood of any heart attack or stroke. Okay? So as per your health history, recently you were diagnosed with coronary artery disease after an ER visit, correct? Yeah, okay, so coronary artery disease is caused by the tightening of your body's coronary arteries, and that's due to the gradual development of cholesterol, fat, and other substances around the blood vessels of your heart. Yeah.
So how did I get coronary artery disease, and what can I do in order to prevent it?
Oh, okay, I'm so happy you asked. So with aerobic exercise, a healthy balanced diet, and keeping on top of your medication, so taking it every day as prescribed, it can definitely reverse the severity of the disease. So unfortunately, the way you got it is unknown. It could be from family history, it could be genetic, it could be from eating an unhealthy diet, it could also be a lack of physical exercise, sometimes even very high stress levels. But don't blame yourself. 1 in 12 Canadians over the age of 20 have been diagnosed with coronary artery disease. Does your family have any heart problems?
Yes, my grandmother does.
Your grandmother does. Okay, yeah. So the medication will definitely be helpful in your scenario. So I'm just going to go ahead and tell you the side effects, okay? So simvastatin is generally a well-tolerated drug. Many patients are on it. But of course, with each medication comes some side effects. So some things I want you to really watch out for is any dizziness, headache, memory loss, or struggle to sleep, which is called insomnia, okay? So if you have any constipation, stomach aches, very bad pain, okay, also keep an eye out for that. Any really itchy red skin is also a side effect, not too common, but just make sure you look out for that. And any muscle pain or weakness, very important that you call the doctor or even go to the urgent care if you tend to feel that, okay? And it also can cause blurry vision, so I'm going to schedule you monthly visits with the optometrist just to make sure that there are no side effects with that too, okay? So I know this seems like a lot. I will give you a printout to take home to keep your memory fresh on any of these side effects. Okay, so there is some things I want you to avoid when taking this medication, so make sure you fully avoid grapefruit juice, okay? It can be very dangerous. It can increase the levels of medication in your blood. It can also increase the risk of a severe side effect, which is rhabdomyolysis, okay? So that's the muscle pain that I want you to watch out for, but just make sure you avoid grapefruit juice altogether. Okay, so how many alcohol beverages do you consume on a week?
I would say 2 to 3.
2 to 3, okay. So with this medication, we want to reduce our alcohol intake. That will definitely make the medication more efficient and also slow the disease progress, okay? So just be mindful with what you're drinking. No more than 4 beverages a week, okay? Just keep that in the back of your head. Also, if you develop any severe side effects like tightening of the throat, like you're having an allergic reaction, go to the emergency room immediately, but that's a complete side effect that most likely won't happen, okay? So when you are taking new medications, just make sure that there are no interactions, but as your healthcare professional team, we will be the ones to notify you if there is possible interactions. Yeah. And if you're taking any over-the-counter medications, all is okay. Any Tylenol, Advil, okay. Just use cautiously if you're supplementing niacin. Okay? Okay, awesome. So what is one type of beverage we're going to avoid while on this medication?
Any alcoholic beverage.
And grapefruits, you're right, and grapefruit juice. Okay, good job. Awesome. So I have some printouts I will give to you to take home. Okay? And we're going to take this medication at bedtime. So it works at night, actually. It's going to inhibit that cholesterol synthesis at bedtime. So it's definitely important to take at night. It doesn't need to be taken with food or anything. It's a pretty low maintenance medication. Just make sure to take it at nighttime.
Great.
Yeah,
Thank you so much.
You're welcome. You have a wonderful evening.